Local health officials are reminding people about the dangers of breast cancer and the steps you can take to try and prevent it after the tragic death of Kelly Preston at just 57 years old.
Joining us to give us some tips is Dr. Amy Hopp of Spectrum Health's Comprehensive Breast Clinic. Good morning. Thanks for being here.
Good morning.
So first, let's just talk a little bit specifically, about Kelly Preston and, just 57 years old, battled breast cancer for several years, but still so young, really, at the end of the day. And that's the reality, is that I feel like more often we're hearing stories about people battling breast cancer at even younger ages than that.
Yes, it is young, like you said, and that is why I recommend starting screening early, starting screening at 40, because these cases can happen to younger women.
Let's talk too about, I know that we've heard many times over the years about women making sure that they're keeping an eye on things and self-examinations. How important is that? And then also be following up with their doctor.
So self-examination is important. I usually tell patients I don't expect that people would self-diagnose, but that you just be breast exam aware, that you know what's normal for you, and if there's any changes that you make your doctor aware right away, so that you can have an exam with them, and if needed,
How would you say, things have changed or evolved over the years when it comes to mammograms and, getting women in and making sure that they really are making that a priority?
So there's a lot of awareness around it, which is wonderful. We now have a lot of locations that offer screening mammograms. 3D mammogram has advanced things for women with dense breast tissue. So that is something that we recommend that women talk to their physicians about if that's something that they need. That's important. We've also come a long way at identifying women that are high risk for breast cancer and making them aware of extra things that they may need to do.
And you talked about the high risk. Who are people that might be considered high risk?
So women that have a family history can be at higher risk in some cases. Women that are that have children at an older age, women that have dense breast tissue, obesity and smoking are also risk factors. So there's many things that go into it.
And we're looking at some of those statistics now. 1 in 8 women will be diagnosed with, which I think is just very eye-opening for people to hear. And what is the best place, for someone to start if they want to make an appointment? Things like that. How can they start the process?
So I think the first thing is to talk to your regular doctor about those risk factors that I mentioned, and to try to sort through if you are of average risk, which still, like you mentioned, 1 in 8 is still extremely common, but identifying if you're a woman that is at higher risk than that. So I would recommend talking to your regular doctor about that. We also have a high risk clinic here where we can help women to sort through their risk factors and what additional screening measures or precautions could be.
Awesome. Thank you so much for your time this morning.
Dr. Hopp, thank you.